Evaluate the arguments for and against universal healthcare, considering economic, social, and political perspectives. Universal healthcare, a contentious debate on societal well-being. Universal healthcare, a system ensuring access to healthcare for all citizens, remains a focal point of intense debate globally. The arguments for and against its implementation are multifaceted, touching upon economic viability, social equity, and political ideology. Proponents champion it as a fundamental human right and a cornerstone of a just society, while opponents raise concerns about its financial sustainability and potential for government overreach. A thorough evaluation of these diverse perspectives is crucial to understanding the complexities of this critical issue. Economic perspectives, a balancing act of costs and benefits. The economic debate surrounding universal healthcare is a central sticking point. Arguments in favor often highlight the long-term economic benefits of a healthier populace. A key contention is that preventative care, a cornerstone of many universal systems, reduces the incidence of chronic diseases and the need for expensive emergency interventions. This, in turn, can lead to a more productive workforce with lower rates of absenteeism. Furthermore, proponents argue that removing the financial burden of healthcare from employers can stimulate business growth and competitiveness, as companies are freed from the unpredictable and often escalating costs of providing health insurance. Conversely, arguments against universal healthcare frequently center on the immense costs of funding such a system. Critics express concern that the significant tax increases required to finance universal coverage could stifle economic growth by reducing disposable income and investment. There's also the fear that government-controlled healthcare could lead to inefficiencies, with bloated bureaucracies and a lack of the competitive pressures that drive innovation and cost-effectiveness in the private sector. The potential for long wait times for certain procedures, as seen in some countries with universal healthcare, is also cited as a significant economic drawback, as it can delay a person's return to the workforce. Social perspectives, the moral imperative versus individual responsibility. The social arguments surrounding universal healthcare are deeply rooted in differing philosophies about the role of society and individual responsibility. Proponents of universal healthcare argue that access to medical care is a fundamental human right, and that no one should suffer or die due to an inability to pay. They emphasize the profound social inequalities that are exacerbated when healthcare is tied to employment or socioeconomic status. A universal system, they contend, promotes a more cohesive and equitable society by ensuring that everyone has the opportunity to lead a healthy and productive life. This can lead to improved public health outcomes, as diseases are more effectively controlled and managed across the entire population. Opponents, on the other hand,